abortion related mortality, that's deaths related to abortion. The secondary prevention was supposed to come before the tertiary, but you should note that the primary prevention was more of like you are trying to educate the person to avoid all those unwanted pregnancies. Tertiary prevention is now at the complication level. So what's the secondary prevention? So let's look at the secondary prevention. So secondary prevention, mainly you are focusing on trying to early on dictate the pregnancy, and if abortion is legal in the country which you stay, if you want to put out the abortion, then you guys have to start the process quickly, because as the pregnancy age, okay, the possibilities of being able to put it out reduces. So early recognition and diagnosis, community awareness, you have to educate women and communities to recognize warning signs, like they should know when there's heavy bleedings, when there's severe abdominal pain, when there's fever or foul smelling discharge from the vagina. Okay, so they should know how to seek medical attention quickly. Okay, and they should be able to prompt medical evaluation and all of that. Okay, and for the medical professional side, they should be fully trained, and the health facilities should have all the required tools and everything. Okay, so they should also be trained on how to use ultrasound, how to do blood tests, how to do pelvic examinations, and the rest of it. So timely post-abortion care. So after abortion is done, okay, the woman's body is actually trying to recoup and come back and everything. Do you understand? So abortion care that time is very important. If there's risk for infections, you give antibiotics. If they have lost so much blood, you transfuse blood replacement. If there's so much pain, you try to manage the pain. Okay, so access to emergency services. So emergency services should be available 24/7. Okay, referral systems. So you have higher facilities, so that you from a lower facility, if you're not able to handle a particular complication of abortion, you can refer it to those facilities. Okay, then the healthcare providers there should be skilled. So on the healthcare system surveillance now, every case of those deaths related to abortion should be properly reported. So let me reply to somebody. Okay, properly reported. Okay, everything that happened from beginning to end. Okay, so that other people can read up these things and learn. Quality improvement. So as you go on and go on and go on, basically you should always improve the healthcare systems. Patient education and counseling. So the patient should be able to know about this thing, contraceptions. All right, so that they can stop unwanted pregnancies from coming in. All right, emotional support should address trauma and stigma through counseling and support groups and everything. So I think that's what we got. All right, that's what we got as related to the second